Hi everyone, I'm Cynthia. I'm a PA out of Minnesota. I just wanted to take a few minutes to give a review on a course that I attended put on by International Pain Academy, or IPA, and PainExam. So I attended a pain medicine board review course in June of this year, 2022, in Dallas. And other than being extremely hot in Dallas, it was a really great experience. Now, as a physician assistant, my boards consist of, they're heavily weighted in family medicine and primary care. Can range anywhere from obstetrics to infectious disease. So I did not really attend this course specifically for, as it was titled or intended, as a board exam review course. For those that are attending it for the title, the material was very, very high yield, and it had a significant impact on being able to study for boards. However, I would really recommend it to anyone, whether you're studying for boards or you see or treat pain on a day-to-day basis. I work in orthopedic spine, so I really do manage pain on a daily basis. So anyone in that position, or even emergency medicine, this would still be a very significantly helpful course. Now, the course itself was definitely not what I expected, and I mean that in the best way possible. A lot of the conferences that I have attended over the years is usually just a conglomerate of people coming in and out for lectures. You kind of sit through the lecture, you take the notes, you leave for, a snack or a bathroom break, you come back and just repeat the same thing over and over again. This was very intimate, very interactive. There was discussion during the lectures. There was a lot of comfortability being able to attempt discussion or asking questions during, but there was also discussion before the lectures and after the lectures. And I think that just makes things a lot more interactive than kind of what you expect from typical conferences. Dr. Rosenblum and Dr. Al were extremely knowledgeable. They are both, amazing doctors, but also amazing teachers. So truly a great pair to be heading the International Pain Academy. They are both very willing to go over questions that even seem like basic entry-level questions, but then they're also very willing to be part of open discussion for unanswered questions, which is generally the world of medicine these days. There's a lot of unanswered questions. What if, what does the evidence show? And both of them are willing to dive into that. One of the other things I liked about this conference, and like about International Pain Academy in general, is they are so welcoming to all levels of providers. So whether you're an advanced practice provider like me, a PA, a nurse practitioner, or a fellow, a resident, a new physician, or someone who's been practicing for many years, I felt like IPA cares about any role that you have in medicine and as a provider for treating patients. So I did not feel the entire time I was there that I was any less welcome than the physician sitting next to me, or that my questions were any less important. And I definitely feel like as a PA, for those of you other PAs or nurse practitioners maybe that are listening, that is kind of always one concern that I've had going to different conferences is, am I going to, feel kind of out of place for being there? And so to kind of summarize or close down, I think all of these points really speak volumes to the idea that International Pain Academy is really trying to accomplish. That, no matter what level or type of provider you are, if you're treating pain, IPA's goal is to make sure that you are equipped with the most up-to-date information in pain medicine, the best practices to make sure that patient care is not only safe but efficacious, and that you are doing, or at least knowing that you're doing the best you can within the scope of practice that you have. So I highly encourage anyone, especially advanced practice providers, so PAs, nurse practitioners, sign up and attend these conferences that IPA has to offer, because they give you a wealth of material. They make you feel welcome, and it definitely only can make you a better provider in the long run. I do also want to mention, and then I'll let everybody go, that I did also attend the ultrasound course on the last day. The ultrasound course was great. So anyone who wants to do any type of interventional procedures with ultrasound guidance, this is a course to attend. You truly get one-on-one, hands-on time. You are not lost in an entire sea of people. Dr. Rosenblum and Dr. Al make sure that you get what you want coming out of this course, and they take the time to make sure that you are given the education and the experience that you were looking for. And so again, really recommend these courses to anyone. If you have any hesitation in signing up, don't. Just go for it. You'll learn a lot. You'll be really happy that you went.